Hi, I'm Leon Tarian with the Power of the Patient Project. Today, my guest is licensed creative arts therapist Chang-Lit, who uses music and creativity to help patients find deeper meaning within their own lives. She believes that therapy is more of a spiritual journey rather than the basic diagnosis that one might receive from a medical professional. In her practices, she attempts to use methods to make her clients feel safe and to find a connection within themselves. Ms. Chang-Lit has been conducting the practice for 12 years and will share her expertise with us today. Thank you for joining us, Wen.
Thank you for having me. Yeah.
Of course. And the first question I have for you is what motivated you to become a licensed therapist, and how have your techniques changed throughout your practice?
So I decided to pursue the career as a music therapist. In my going into college, and because I would call it my past life, I spent my whole life working towards being a professional musician, classical violinist, and starting at the age of 5, and just music has played important. And it was Sunday to notice that what I love about music is not applause, but how it really gives me a channel to express all spectrums of feelings. I grew up in Taiwan, and with the culture, especially for children, children are not encouraged to speak our minds or express feelings, and just listen and be obedient and be a good kid, meaning you're quiet and do your work. So I think for me, it's through music, and when I'm working on a piece of music, that I tell a story, right? Each piece tells a different story. And when you're telling a story and playing different characters, you access different parts of you, different kind of emotions. So in real life, I have to be quiet. I can't get anger, or is considered not appropriate behavior, right? But in music, I can be angry, and it's welcome, it's embraced. Through music, I can feel the pain, and I can access it and create beauty through that pain. And so I can be aggressive, I can be seductive, all those things that in real life we have to control, right? We have to be. So I think music playing in my life, it makes me whole. And because of that experience, I started to consider, music therapy, that makes sense. And that's what I want to do. That's why in 2008, I decided to change my direction a little bit from performing and to do music therapy. So now I'm a licensed creative arts therapist, and especially in the past couple of years, I also received trauma-informed training, and so and which also include EMDR, eye movement desensitization, reprocessing, and other somatic practices. So I think my practice has changed from working solely through music and music-centered music therapy, where music is the primary channel for connection and expression, with people nonverbal, maybe kids with autism or neurodiverse children, to elderly with dementia. Music just directly tap into the healthy core, and that connection starts, right? And now I think throughout the years, now my work has been focused more on trauma and psychotherapy. And so I utilize music in a little different way through a lot of music imagery and even songwriting that incorporates vocal toning for mindfulness practice too, and just using voice in a therapeutic way. And so that's my focus now.
That's amazing. And can you tell us about when and why you started incorporating music and imagery practices in your therapy sessions with patients?
Yes, so I did training in 2019, and it was really profound, the experience, and the training itself is for us to experience that power of music imagery. And before that, my practice was more making live music and let the music happen in the moment. Music imagery is a little different. It's, for example, a client talks about what's bothering her, and then when she says something, emotion comes up. So that's the core, right? And if we keep talking, oftentimes words can get distracting, and then that feeling goes away. So music imagery, in that case, we pause there and say, okay, can let's stay in this emotion, this feeling a little bit. Let's explore it, right? Not walk away from it, because if it's activating, it's meaningful. So it feels like in the body, looks like texture, temperature, shape, or meaning. And then choose a piece of music that has elements that matches that. So through that choosing process, I'm helping the client to get more in touch with the feeling, which they might be afraid of knowing, right? But through exploration, it's safer. And then we choose together the music that matches the best the emotional state. And then the music works as a holding, a containment, so that it's not gonna feel overwhelming, because oftentimes that's why we're afraid of feelings, right? Oh, I'm afraid to be overwhelmed. But music, because it moves and has a sense of structure. And so, and then the client start to create imagery. And it doesn't have to be representative. You can just just getting to the lower part of our brain, the limbic system, where it's responsible for our emotions and behaviors. And then through that creation, first of all, it physically releases tension and releases the feeling. And feeling is energy. So if you don't express it or you release it, it gets stuck in the body, and that's where a lot of illness is the root. That's the root, is the suppression of feeling, right? So you are allowing that energy to flow on a piece of paper. And then after that, so oftentimes after that, the client feels calmer, and then feel like, okay, that's a stopping point. And we look at the image together. And that's another, and so we talk about, well, how does that impact you, and what insights do you see there? And oftentimes they find insights that's surprising to them. And also what's very cool is that maybe something feels overwhelming internally. When you put it out on the paper, it's concrete. And if you can see the enemy, it's not as scary anymore, right? So if you can see that on the piece of paper, you and this is very effective in increasing psychology. Don't like to feel anger, or clients who don't like to feel sadness, they realize that, oh, I can tolerate it now, and then I get information from it, and then through that they learn more about themselves, and there's more self-acceptance in the process.
Wow, it's a lot of great information, and that you're able to help your clients through using music imagery. And What is this actual effect of music and creativity on the therapy you encounter with your patients? Like, what are these like actual reactions that you've experienced with them throughout your sessions?
Oftentimes, there will be an emotional release, and that feels good. They might express, "Oh, I feel calmer,
Yeah.
I feel lighter," right? And then, or they're looking at the image and then say, "I never realized that this has been bothering me," or, "Oh, I never realized I had so much, that memory causes so much pain, and now it makes sense," right? So the insight that came from it is extremely important. And that process, that insight that they can get, can be achieved with one session, comparing to just talking about or talking around it, right? You can't really talk yourself out of emotions. You have, right? Have you experienced that? Like, oh, why am I feeling that way? I shouldn't be feeling that way, but this is how I feel. So that doesn't really work. You need to get to that emotion and get in touch with it, release it, and then find meaning from it. And that's what we're doing.
Yeah, definitely. And can you share with us these trauma-informed approaches on your work because of the collective trauma that one might be dealing with because there's a pandemic going on?
Yeah,
There's
yeah.
definitely been a lot of that.
So trauma is a big topic, especially now, I think. And if it's not acknowledged, it's passed from generation to generation. So it's very important to acknowledge that trauma is part of life. And trauma-informed therapy is that we, instead of asking the client or the patient, "What's wrong with you?" or giving them a diagnosis or a name of, "Oh, this is what's wrong with you," we ask the question, "What happened? What happened to you?" And when you are changing that question, there's already an element of empathy and compassion, right? And then it's really through that empathy and compassion that the other person feels comfortable to really, because they feel seen, right? They don't need more shame. Nobody needs more shame on top of their suffering. So when you're asking what happened to you, they're so open to share the past. And then, oh, so those symptoms that maybe the medicine tried to get rid of or suppress, right? Those symptoms they happen to, they exist for a reason. And oftentimes that's how somebody cope with a very terrible life experience, right? Alcohol, drinking, drug use, or any kind. Those are all coping mechanisms, even though they're maladaptive. They use it because then it takes away the pain, right? So when you're asking the right question and wondering, okay, that's what happened, then the patient, client himself can feel more empathy because there's a lot of internalized shame. We don't want them to, because then you can't really work through the pain if there's shame attached to it. So that's trauma-informed approach, is to really trying to understand what happened and help the client understand what happened, and giving them an information that you're not crazy. There's nothing wrong with you. Those habits are formed because you needed to. It helps you survive. And when they hear that, oh, what a release, right? Help me survive. That's right. And they grow more appreciative of their own body. And then another big thing about trauma-informed approach is that trauma lives in the body.
It's like sort of like a release.
Yes, and because trauma lives in the body, talking about it doesn't help because it's not connected. Our frontal lobe is not connected to where the trauma is stored. It's the limbic system and the lower part of our brain. And so we have to do somatic work to release that trauma. Yeah.
And in your opinion, why should the medical profession consider non-traditional practices such as music and as imagery to aid with a client that might be struggling emotionally?
Because first of all, music taps into the limbic system, which is the emotional part of our brain. It just gets there so directly, without having to say anything. You can gain a connection, understanding just through music and that, right? And so, and then it's after that feeling is released that, because I believe that a lot of medical illness or mental illness is prolonged saying no to yourself. Each time when you have to suppress a feeling in order to fit in order to please others, in order to not get hurt, then you're saying no to yourself. And the longer we do that, and we all do that, right? Because we're social animal, we need to survive. When we do that long enough, when the energy is stuck inside, it's going to manifest somewhere. So it can be through migraine, it can be through a stomach ulcer, it can be cancer. It can also turn into depression if you keep suppressing your feelings, right? Or anxiety. So all the problems we see today can basic. The root is saying no to ourselves all the time, suppressing that need to be who we are and be accepted, right? So I think for medical field, we need to acknowledge that, acknowledge a person as a whole, a person within, not just separating body and mind, but seeing and connecting body, mind, and spirit. And creativity and creative arts therapy works that way.
And the final question I have for you is, how do you feel technology has enhanced the practice of therapy? Is technology important to your particular practice?
Yeah, I think one of the silver lining, can you hear me? Yeah, one of the silver lining of the pandemic is telemedicine, teletherapy, because it's so easy. Everybody can just stay out where they are. You don't have to commute for an hour to go to a therapy session. You can do it as long, of course, given that you have a safe home and a private space that allows you to feel safe enough to talk to a therapist. But the technology definitely makes it easier. And hopefully it will continue because it makes therapy more accessible and takes away a lot of, like some people don't like to travel, some people can't travel, right? And then some people might not want other people to know that they're in therapy, so that exchange in a waiting room can feel awkward. But this can be the first step of seeking help, of feeling relatively safe. Yeah.
Absolutely. Thank you for your responses. We really appreciate you coming on to conduct an interview with me and to discuss all these new practices and how these unconventional approaches can help someone find their emotion and their happiness and meaning within life.
Thank you.
And at the Power of the Patient, we wish you the best of luck continuing your practices and would love to follow up with you anytime.
Thank you so much.
To even schedule an interview in the future. Thank you very much.
Thank you.